Hello, thank you for joining us for our Entrepreneurial Inspiration Conversations. Today we are joined by Alverno alumna Clarissa Lawrence and Alverno student Lisa Heidelmeier. Lisa, can I have you introduce yourself?
Yeah, hi, I am Lisa Heidelmeier. I'm a student at Alverno studying business management.
Wonderful, thank you. And Clarissa, can you briefly introduce yourself?
Sure. My name is Clarissa Lawrence. I am an Alverno alum, class of 2012 and 2018. I am currently a family nurse practitioner and primary care provider, as well as a student in the Doctor of Nursing Practice program at Alverno.
That's wonderful. It sounds like you've got a lot going on. So I will not take up any more time. I'll turn things over to Lisa. Thank you.
All right, Clarissa, I just wanted to thank you again for your time and joining us. You are the co-owner of your family nurse practitioner, MyNP Professional, as well as you are the CEO and founder of your community health primary care services. Could you just explain a little bit about what your day-to-day life looks like for you?
Sure. I would like to give a little background on both practices. My MP Professional's Family Medical Clinic, that was founded by Dr. Rosalind McFarland, who was my business partner. That was founded in 2017. I became the co-owner of the clinic in January of 2019. Community Health Primary Care Services, I founded this house calls and telehealth practice in March of 2020. Um, Far as day to day, it's different. It varies. At my MP Professionals, just the day to day clinic operations, staff meetings, business meetings, seeing patients because Dr. McFarland and I are both primary care providers. Far as community health primary care services, just communicating with my corporate partners, seeing patients in their homes, also providing immunizations and lead screenings to children in the home. So it just varies day to day, pretty busy.
Yeah, everything's different. No consistent day. It sounds like your
Yeah.
days booked every day. Um, I know you have extensive experience within the medical field before you decided to come back for your master's and now your doctorate. Was there any deciding factor that made you, through those experiences, want to start your own business and become like an entrepreneur?
Um, no. Being a entrepreneur was never in the plan. It actually just happened. When I was going through my BSN program, absolutely not. My master's degree, I believe there was a paper that I wrote that was talking about a home health agency, a house calls practice that was innovative and something I would be interested in starting. Even though in my mind it was just an assignment to hand in, I didn't realize that I was actually writing my vision for it to actually come to pass. The doctorate program, we had an assignment to complete like a mini business plan. So I kind of touched on the business aspect as far as the business plan, and that's pretty much it. That's the only, yeah, that's pretty much it.
You just fell right into it.
Fell right into it.
Awesome. What would you pinpoint as your greatest successes within either your undergrad, your master's and your doctorate, or just anything in general of this entrepreneur?
Um, my greatest successes, I would say, just providing access to care to my patients. Um, a lot of the patients that I serve are underserved, and they have little to access to no care. They may not have insurance, or the insurance that they have, some providers or clinics may not accept. So just providing that access to care here at the clinic as well, in the homes, is the greatest success for me. just
Yeah,
taking care of one patient at a time, one family at a time.
that's awesome. I just want to add an additional question. Um, does your clinic have like a set rule or a guideline of what insurances you accept, or is it just if you need the help, you need your vaccine or your immunizations, anything, they can just come to you? How does that work?
Yes, we accept just about any insurance. We also accept patients who are not insured. We have payment plans, and just we try to make it as flexible and as feasible as possible. We also accept Medicaid. Um, we don't want to leave any patient or family out. So we try to serve the entire community.
Yeah, that's awesome. That's really important nowadays. Um, on the flip side, what have been some of the biggest challenges during this time, and how have you overcame them?
Okay, far as the clinic, sometimes there are days when I do not have patients scheduled. And again, I started my house calls practice, community health primary care services, right when COVID kind of,
Yeah.
happened. And I didn't see my first patient for my house calls practice until August. So it was kind of discouraging, but I just stayed the course. I kept my faith. I kept going. So I would encourage anyone, when you have those days when things aren't going as planned and you want them, just know that your vision will be carried out. It may not be as straight and smooth as you expect, but just stay the course.
Yeah, that's awesome. I know we touched a little bit earlier on your day-to-day tasks, but you had also mentioned that you are in the doctorate program here. How do you manage your time between all of those responsibilities, from the two businesses to school? How does that look?
Oh my goodness, I don't know. A lot of prayer, a lot of love and support from family, and great time management. You have to have great time management to balance anything and be successful at anything. You have to have great time management.
Yeah, that's awesome. That's definitely important. Um, I know we touched again a little bit earlier on your two additional degrees, and but could you elaborate just a little bit more on any experience or something that happened to you while you were in either your undergrad or master's that kind of led you to one or another? Um, I know it just kind of fell in and you wrote an assignment business plan, but did you have any experiences or saw a need that made you want to do this?
Absolutely. I worked as a home health nurse for several years, and I saw homebound patients all the time. And the common concern that my patients had at that time was one, their current primary care provider who was visiting them was no longer visiting them anymore. And my other patients that actually did leave the house only for doctor appointments, they also, just talked about how hard it was physically for them to even just get dressed to go. And so I thought to myself, oh my goodness, this is terrible. What are these patients going to do? Because of the shortage in primary care providers as well as visiting providers. So I thought to myself, okay, so what are you going to do about it? And that's how Community Health Primary Care Services was birthed.
That's awesome. That's such a nice success story here, and it's only starting, right? um, how has the 8 abilities here at Alverno gone into your success within your business or businesses, if you want to touch on both of them?
Well, I use the 8 abilities every day. Um, in what
You'll
in
never
order
get
to
away
be.
from them. They're there for a reason, right?
That's right. That is so true. And as one of the leaders in healthcare, you have to effectively communicate.
Mhm.
You have to also have the compassion and be willing to want to serve your community. You have to have cultural competence and cultural awareness to serve different populations. So
Yeah,
those are the abilities that are near and dear to my heart.
that's awesome. When you had started way back, starting with your very first um, introduction to the health field, was there someone that inspired you to look at this journey?
Um, I've always wanted to help people.
Mhm.
Um, I never thought that I would want to be a healthcare provider or primary care provider. I just wanted to be a nurse and work at the hospital and just help people. But I guess, the good Lord had other plans for me. And so I, expanded, my education and everything. But far as my education in nursing, I did have some mentors along the way. For my BSN program, my nursing program, Shanita Washington, who is currently an Alverno instructor, she was my mentor during the BSN program. And my business partner, Dr. Rosenberg, was my mentor and preceptor through my nurse practitioner training.
That's awesome. Did those two individuals help guide you into entrepreneur, or was it more so just your business partner and help you mentor you through the changes and new responsibilities that you have?
Yes, it was my business partner. When she asked me to join her as a partner, I was like, oh my goodness. But yeah, because again, entrepreneurship was never in the plan at all. So yeah, the partnership, we went from preceptorship to mentorship to partnership. So yeah.
Okay. What advice would you give someone that's interested in the health field and the business field? And how do they relate?
Okay, far as the healthcare field, I would recommend that you follow your passion and not trends. And what I mean by that, I've had so many colleagues that, kind of followed trends. Um, they followed jobs that were very popular. Um, and they found that either during the education, it was something that they weren't interested in, or they actually graduated and started working in that area and they were unhappy and ended up going into another area of nursing. And that's why I say I just recommend that you do your research. You do your research on the education and you do your research on the actual career. So you'll know exactly what you're getting into before you make that formal decision. Far as business, um, I do not have a business degree. I am a clinician, so I had to rely on community resources to help build my knowledge with different business topics. When I first started out, I believe WIBIC, which is the Women's Business Initiative Corporation, they have free webinars and um, classes that women can take if they're thinking about expanding their business, starting a business. They just have a lot of resources that anyone can take advantage of.
Yeah, that's awesome. It's good to know that there's resources out there for, anyone to use and that you use those because that's what they're there for. So that's nice. Um, what brings you the most joy relating to what you do every day?
Every day, what brings me joy is the fact that I am changing lives for the better. again, I know I've mentioned it before, just being that resource, providing access to care for families that are in need. That's enough for me.
Yeah, that's awesome. That's super important. Uh, could you tell us your take on what it means to be Alverno Strong? What does it mean to you?
What it means to me to be Alverno Strong is to be proud of your education, proud of your college, and also not forgetting those Alverno sisters behind you. Um, I remember when I had more time, I was an assessor for the nursing department. I was invited back to speak to the nursing students to give them words of encouragement and mentor Alverno up and coming nurses. So that's what it means to be Alverno Strong to me, to just be confident in my education, proud of my education, and never forget the Alverno sisters that's behind me.
Yeah, that's awesome. We're definitely all together, aren't we?
Yes, we are.
Um,
In this together.
yep. Yeah. All right. Well, thank you for meeting with me today, Clarissa. It was super nice to talk to you and learn more about what you do and all your practices and responsibilities. It's just amazing. You're amazing.
Thank you. Thanks so much for having me.
Yes, thank you.
Thanks so much to both of you for your conversation. It was really engaging and informative, and I know our audience will find it really valuable. And they can check out more conversations just like this one on our alum Facebook page. So thank you.
Awesome.
Thank you.